Welcome back. Persistent runny noses, sneezing and itchy eyes. These are some of the symptoms that people with allergic rhinitis suffer from every day.
Some people know it as hay fever. As many as 10 to 30% of adults experience these symptoms, and in children it's about 40%. But does allergic rhinitis have to necessarily be the burden it currently is? How can we bring these symptoms under control?
And here to help us, ear, nose and throat specialist Dr Leong Jern Lin and pharmacist Christine Tseng. Good morning and great to have you on the show with us. Yvonne, you mentioned that it's basically hay fever, but there is a little bit of difference with hay fever, is that correct?
Yes. Locally, allergic rhinitis is a year-round thing. We don't have the 4 seasons. So you find that people are not sick sometimes, they're sick most of the time. So these are the ones that are actually in trouble. And it can be quite, debilitated.
Tell us exactly what is allergic rhinitis.
It's hypersensitivity. It's when people who are allergic to certain things in the environment, when they come across these items, these allergens, they actually start having sneezing, itching, rhinitis, runny nose, and even coughs.
Such as dust allergens, meaning dust, pollen.
Most commonly is dust mites, cats, dogs. Outdoor will be pollens and even fungus and grasses.
And it's closely associated with asthma as well, am I correct in saying?
Yes, locally about 14% of people who have allergies actually have asthma at the same time. Because allergy is an overall response, and so it can manifest in the nose, the lungs, as well as the skin.
Well, what I'm really surprised is the high and increased rates over the years. Up to 40% of children suffer from this condition. Is that right, Christine? What is the cause behind this rise?
I think it's because a lot of times now people are moving from rural living to city living, and in the city there's more air pollution, the air quality is not as good, and also there's therefore greater exposure to the allergens.
What about here in Singapore specifically? Why do you think that more people are suffering from this condition?
Yeah, it's being exposed to the allergens, like indoor living most of the time. Like one of the most common allergen is dust mite, and so things like upholstery, curtains, and these are things that, you know, a lot of dust mite, and therefore people can be exposed to them.
The fact that it affects children especially, do you think, some people say that perhaps Singapore is quite sterile, so they're not exposed to germs, etc., so therefore they will be likely to get this more. Is there any truth to that?
Well, I guess there's a possibility. Dr. Leong can probably attest to.
What do you say to that?
There is a hypothesis where if you grow up in a very clean environment, so all your immune system is geared towards not fighting germs, but now expressing as allergic response.
Right. Well, you mentioned just now that it can be quite debilitating, but to what extent can it really affect the quality of life for someone suffering from it?
People with allergies can have other issues as well. The very bad ones can even have, more likely to have sinusitis, glue ears or blocked ears, so affecting their hearing. And the very bad ones can even have problem with sleeping, which is very common with people with chronic nose problem. They can't sleep well, so the next day they are grumpy, they cannot concentrate, and they cannot remember things. So for both children and adults, it affects their work, their schoolwork as well. So you can have hyperactive kids from a bad allergy problem.
Well, what treatment is available?
There are multiple treatments. In the less severe cases, they can go, because they treat by the symptoms like running nose, there's antihistamines and also decongestants. But as they get more severe symptoms or more prolonged, they might need to do continuous medications like intranasal steroids.
Would you
these are some examples.
Would you recommend that, especially for kids? Or would you look at perhaps taking away the allergens or trying to limit their exposure to them more so?
Definitely. Yeah, medications won't be the only thing. We also need to advise them on lifestyle modification, like we said, exposure to allergens and how to keep the place clean, how to know what are your allergens that's causing you to respond this way and how to avoid them.
Are there specific tests for that? That you can test allergens?
Yes, we do. We can do a skin prick test. We have a panel of both outdoor and indoor allergens, and we place it on the skin. It's not painful. It takes about 20 minutes, and we can tell what you're allergic to.
But the lifestyle changes and the different medication you talk about, they're all short-term fixes. Is there anything that you can actually do to stop the problem altogether?
The only cure actually is immunotherapy, and it's a form of treatment whereby Locally, we can give sublingual immunotherapy from 6 years old above. So what we do is we find out what you're allergic to, and then we use the proteins you're allergic to, make it into a vial of treatment vial, and they can drop it under their tongue on a daily basis.
Well, Christine, what can you advise as a pharmacist and people can get over the counter?
Over the counter now we have antihistamines, we also have decongestants. These are usually come in a form of pills, but really they are for their symptoms. They can give you quite fast relief, but for continuous management, actually the class of medication will be intranasal corticosteroids that actually work on suppressing the allergy and the inflammation. And although their action is not so fast, I mean, they will act immediately to control the inflammation and allergy, but to really feel the difference, you might take 3 to 4 days. But they are a very good class of medications, and they actually give prolonged relief. Yeah, on top of, you know, the symptoms.
Now, if you don't take any medication, is it possible to build up resistance against some of these allergens?
You do get better with age. Most people that have allergy problems are children, teenagers, young adults, 20s, 30s. By and large, the natural history is such that when you're like 50s, 60s, it goes away.
It's a long time to be waiting.
It's a long time. For the bad ones, I don't think they can wait that long.
Yeah, and sometimes we don't know the true reason, but sometimes the symptoms are worse, sometimes they are better. So for a long time, people don't really know that maybe they have allergic rhinitis. They're just going like, oh, I have running nose, I have blocked nose, and they come to the pharmacy and they ask for relief for these symptoms. But when you ask them more, you actually find out that it can be more prolonged, and then you consider, you know, allergic rhinitis, and then we teach them about the different classes of medicine and how they can work, when to use what, and to have a realistic expectations of their medications as well.
Because of course this condition is probably more widespread than we know it to be, isn't it? Because a lot of people probably don't go to take themselves to the doctor or treat it.
Yeah, they do. And a lot of times it actually runs in the family. So the whole family has it. When the whole family has it, you think it's normal. So when they live in a family like this, they never get relief.
And can it get worse?
It can get worse. I mean, those people who end up not sleeping well, I mean, there's even studies to show that children, compared to their peers without allergic rhinitis, you can actually get a grade lower when it comes to exam grades.
I guess because it affects your mental ability to concentrate.
You know, you're always doing the sniffing and stuff. You won't be able to study well.
So, Christine, with some of the medications, are there any side effects to using them?
There will always be side effects with medications. Even the safest medicine would have side effects. But the key is to know that what are the benefits versus the risk. So some of the side effects, the minor risks we're talking about is, for example, some older generation antihistamine can cause drowsiness. But sometimes we put that to good use. You can take it at night and help you to sleep as well. And also because of their drying effect, you can get like dry throat. And yeah, in some of the intranasal steroids, you can get some headache or irritations to the throat. If you don't use them properly as well.
I guess a lot of people with this condition, it can be solved by visiting the pharmacist and getting over-the-counter medication. But at what point should people seek a doctor's advice?
For the straightforward cases, once you use allergy medicine, actually you'll feel about 80–90% well. For whatever reason, if you find that it's only about 10–20% or less than 50%, it may be something more than the allergies. Most commonly, it's actually a sinusitis, where you get headaches, you get blocked ears, even from going up and down the elevators, or you can coughed up green-yellow phlegm occasionally. So that's a sign of more infective problem rather than just allergies.
Right, okay.
Well, thank you very much indeed for coming and talking to us about it today. It's obviously a problem that affects many, many people, so I'm sure lots of people are watching out and trying to learn how they can sort the problem.
Thank you so much.
Thank you.
That was ENT specialist Dr Leong Jern Lin and pharmacist Christine Teng speaking to us about the treatments available for people suffering from allergic rhinitis.